go-to platform for any healthcare discourse across the globe. I'm Dr. Ritika, and I'll be your host for all the Assimilate session series. Assimilate by Midvarsity curates cutting-edge conversation across various health categories by renowned health experts like you. So before we proceed, let me take you through our format. Every day, we invite top industry leaders from healthcare and ask them to share their insights through real life case discussions or discussion as per se. Attendees are invited to join in for the discussion with their insights, doubts, suggestions, and in general to start a conversation over healthcare. The aim is to unravel the case and its learning as a group. So today we are here talking about hookah effects on young generation, which is presented by Dr. Rakesh Gupta. He is the President and Director of Public Health at Strategic Institute for Public Health Education and Research in Chandigarh, India. He is a distinguished figure in public health, awarded the WHO Award in 2015 for his efforts on World No Tobacco Day. Dr. Gupta has been prominent representative for the Ministry of Health and Family Welfare at various WHO consultations, including those on e-cigarettes, plain packaging, and global consultation on flavors in tobacco and ENDAs in 2023. His international engagement highlights his commitment to staying informed about global health challenges. In 2019, he received the SBI Award for exemplary services in the medical profession, underscoring his outstanding contribution to healthcare. Dr. Gupta's leadership and dedication continue to set high standards, making a significant impact on public health education, research, and advocacy in India and beyond. A very good afternoon, sir.
Thank you, Dr. Ritika, for the invitation. So we'll be talking about the hookah effects on young generation today. We'll be talking about the hookah history, hookah smoking, myths, facts and health hazards, epidemiology and existing legislations, and the conclusion. So this is the typical hookah you see in the hookah bars. It is called a shisha, goza, nargile, argile, hubble bubble, water pipes, and in different places. So it originated from Persia and India, and it immigrated to Europe and US hookah bars caves. In India, it is in northern and eastern parts, it is used by village folk. And in 1900s, the sweeteners and the flavors, they were added to the hookah material. And the shisha, this is now commonly being used. It is the shredded tobacco mixed with honey, molasses, or the dried fruit. The newer forms of the hookah, they are the e-hookah smoking, then flavorings like apple, mint, cherry, etc. And then what I told you, that molasses, the base sweetened non-tobacco product, and the herbal hookah. So I'll be talking about the effects of the shisha or the hookah. And this is the typical hookahs you see in the hookah bars. So it has got bowl which contains the tobacco, molasses, and the charcoal. Then there's a plate. It is like an ashtray used for dead coals, iron from the previous smoking session. Then this is the body and with the walls. And then this is the water jar. The water jar that is connected to the hose, and this is the mouthpiece. And mouthpiece may be metallic or it may be made up of wood, right? And how does it work? When we inhale through by putting our mouth at the mouthpiece, the heat generated by the charcoal that vaporizes the tobacco material. Then it is taken in and taken in towards the water bowl. The bubbles are produced, and then though it is through the water, it passes through the water, but it doesn't retain the toxins in it, and it reduces the temperature of that tobacco smoke also. So, and the health risk that because in hookah bars you tend to spend more time So there is more risk. Person inhales more smoke over a longer time compared to the cigarette smoking. And the exposure, there's the increased carbon dioxide and nicotine exposure, and that may contribute to the all kinds of health hazards, including cancer and the heart diseases. And the facts about hookah, they are a 1 hour session of the hookah can be as harmful as smoking 100 cigarettes. One hookah session that delivers 25 times the tar of a single cigarette. And also the carbon monoxides and other harmful carcinogens are produced. The amount of smoke inhaled is 90,000 ml in a hookah session. But when we compare to cigarette, it is only 500 to 600 ml. And normally the hookah bar session that lasts from 45 to 1 minute, and there's a lot of socializing. It is a social kind of thing. Carbon monoxide exposure is 9 times a single cigarette, and the nicotine exposure is 1.7 times a single cigarette. So you think that smoking hubbly bubbly or a water pipe, it is a safer alternative to cigarette, then you are mistaken. And do you think that smoking hubbly bubbly is less harmful than smoking cigarettes? It is not. Then the health risks from hookah, excess smoke inhalation in long hookah session is there. Sharing the same pipe can spread the illnesses, the infective illnesses, then same harmful chemicals as cigarettes. And then there's increased risk of cancer, lung dysfunction, heart disease, etc. Then what are the health risks? Nicotine, as you know, it is an addictive product. It is present in all kinds of tobacco products, and it affects the adolescent brain development and has been linked to a variety of adverse health outcomes for the developing fetus also. And it has got the same adverse health effects as the cigarette smoking, such as lung, bladder, oral cancers, heart diseases. The long-term side effects that include the pulmonary function, chronic obstructive airway diseases, esophageal cancer, gastric cancer, and the short-term effects are increased heart rate, increased blood pressure, reduced pulmonary function, and carbon monoxide intoxication. Hookah smoke and the cancer, it is caused by the carbon monoxide, metals, cancer-causing chemicals. Even after it has passed through the water, as I told you, the smoke from a hookah has high levels of these agents, and it leads to lung cancer, bladder cancer, and the oral cancers. And then other side effects of the hookah, as I told you, that the cardiovascular effects are there, as in the any kind of usage of the tobacco, like clogged arteries, then the heart diseases. It also leads to infertility and the erectile dysfunction. Babies born to people who smoke water pipes every day while pregnant, then weigh less at birth. That is at least 3.5 ounces less. So that is one of the very major causes when you're using it as in pregnancy. Hookah smoking compared with the cigarette smoking. The tobacco in hookah is exposed to high heat from the burning charcoal, and the smoke is at least as toxic as cigarette smoke. Carbon monoxide is produced because of the burning of the charcoals. Because of the way hookah is used, a very deep drag is taken. People who smoke hookah may absorb more of the toxic substances, so it may be even more harmful than cigarettes. In a typical 1 hour hookah session, as I told you, that you may inhale 100 to 200 times the amount of smoke they would inhale from a single cigarette. And as I told you, that 90,000 milliliters of smoke is inhaled compared to just 500 to 600 ml when you smoke a cigarette. Then hookahs and second-hand smoke. The second-hand smoke is caused from the charcoal burning as well as from the smoke you inhale. The non-tobacco hookah products are now available, and studies of the tobacco-based shisha and herbal shisha they show that smoke from both preparations that contain carbon monoxide because of the burning of the charcoal and other toxic agents known to increase the risk of smoking-related cancers, heart disease, and the lung diseases. So it leads to oral cancer, stomach cancer, reduced lung function, lung cancer, esophageal cancer, decreased fertility, infectious diseases like tuberculosis, herpes, hepatitis, and recently uh, you must have come across that even the COVID patients, they tend to have more infections, more severe infections when they were using hookahs. So this is the second global tobacco pandemic. So as I told you that even flavored hookahs, they are harmful. Carcinogens, dangerous level of the benzenes, they are inhaled from the lump of smoldering charcoal. It can also cause leukemias. 300 different kinds of flavors are now available, and now maybe even more. Herbal hookah increases the risk for smoking related cancers, heart diseases, and the lung diseases. A recent systemic review that includes the growing popularity of the hookah use among adolescents, 11 to less than 18 years of the age in the United States from 2009 to 2017. National Sample Survey India 2000, household prevalence of hookah tobacco was 2.6% in rural and 0.4% in urban households. In central India, 2016 prevalence of hookah use was 6.4%. And you might have noticed that in bigger towns and in the metros, hookah bars, they are a common thing. And because of peer pressure, or maybe it's a fashion statement, people, they visit hookah bars. And we have seen that even small kids with their school bags, they visit hookah bars. The growing hookah epidemic in India can be attributed to the presence of the hookah lounges, online retail market of the hookah products, and the rising popularity of the tobacco-free hookah. So I may tell you that if a person says that I'm just smoking herbal hookah, then you're mistaken, because nobody will spend 1,500 to 2,000 rupees for an hour session in hookah bars unless there is some addictive product in it. So these are the legislations which can be used for the hookah bars, against hookah bars. So running a hookah bar that invites penal provisions under the following acts, like the Poison Act 1990, Punjab Poison Possession and Sales Rule, then Cigarette and Other Tobacco Product Act, all sections of Cigarette and Other Tobacco Product Act, like Section 4, that is smoking in the public places. Section 5 is that tobacco advertisement, promotion, and sponsorship is not allowed. And when you put a hookah on a table, it is like promoting a smoking product. Then the Food Safety and Standard Act is also applicable, because we are using flavored or sweetened tobacco molasses. Then there may be violation of Section 144 if it is promulgated in the district. Then the license under Food Safety Act can be cancelled in case it is running the restaurants, they are running a hookah bar in the licensed premises. Then you can also apply Drug and Cosmetic Acts, because the nicotine is present in most of the hookah bar materials. Then Juvenile Justice Act, because as I told you, that minors, they normally they go to the hookah bars. Then IPC section 268, 269, 278, that is harmful products. Use of the harmful products in the neighborhood, that can also be promulgated. Then Disaster Management Act and Epidemic Act, that has been invoked in cases of the COVID, during the COVID. So we need to know that what action can be taken against the hookah bar if there's violation of Section 144. FIR can be lodged by police. Panchnama, Caesar memo to be done by the police department. If it is Juvenile Justice Act, FIR has to be lodged by the police. If it is Poison Act, then the action again can be taken by the police. Section 4567, official members of the district level task force. Food Safety Act, food safety officers. Drug and Cosmetic Act, drug safety officers. Then the IPC, all sections can be used by the police officials. They can take action against the violation of these IPC sections. Hookah water pipe tobacco smoke represents a major potential threat to the public health. Running a hookah bar that invites penal provisions under the multiple Indian laws still remains a public health challenge. The governments must frame policies to deal with all the existing gaps in the present laws to protect youth, from the harm caused due to unregulated sale and consumption of the hookah. And we also must tell the youth and the young people in the schools and the colleges that hookahs, they are not a safe alternative to cigarette smoking. Then we actually, these recommendations were sent to the government also. So that an advisory that must be published in the print, electronic, social media about the harms of the hookah. A meeting of the state level coordination committee under NTCP that should be held, and we must tell all the stakeholders present in the meeting that these are harmful things and these are not allowed. No lessons can be given for the hookah bars. A workshop should be held for the state SHO level officers. Then drug control officers should be asked to inspect and draw samples of the molasses containing nicotine being used in hookah bars operating in the jurisdiction and get them analyzed from the laboratory of the government analyst. And police must also be told about the IPC sections, the COTPA and the Poison Act, etc. So these are some of the news items. And this is a sample of the section 144 promulgated in Chandigarh by the district magistrate. So this is also a picture of the raid of the hookah bar. So states where the hookah bars, they are banned under COTPA amendments: Maharashtra, Gujarat, Punjab, Rajasthan, Chandigarh, UT. In these states or union territories, the hookah bars are permanently banned by making amendments under the Cigarette and Other Tobacco Product Act. So what we need to do is we need to, if the people, they are addicted to tobacco smoking and they visit hookah bars very frequently, then they need to quit hookah smoking. And what are the 4 methods or that can be used for making them quit? Is by active motivation and follow-up, then by the behavioral intervention, comorbidity management. As I told you that the tobacco smoke in any form, including hookah, that can cause cancer, cardiovascular, malnutrition, immunity deficiency, and other chronic diseases. All kind of non-communicable diseases can be due to the tobacco usage. And in hookah bars, even the infectious disease can be caused because the mouthpiece, common mouthpiece is used. Then there are drugs also available like nicotine replacement therapy, the varenicline, buprenorphine is there, bupropion is there. So these medication can also be used. And my organization, Sipher, that has also initiated this movement, that freedom from tobacco and nicotine. And we are also doing tobacco cessation for all kinds of tobacco product use, hookah bars, and e-cigarette use. So thanks a lot. So Dr. Nikita, if anybody has questions.
Thank you so much, sir, for such an insightful session. And I would request all my attendees, if you have any questions or you want to ask anything in particular, please write it on the chat box. We'll be taking the questions from there. So, what are the gaps in current policies, as you were telling us about the policies that we need to be addressed to better protect the youth from the risk of hookah smoking?
Actually, as I told you, Dr. Ritika, that there are many laws which can be invoked, right? Because all the hookah bars, they are violating some or other law. And no license is given for the hookah bars. So definitely government that needs to be proactive in closing down the hookah bars. And as I told you, some of the 5 or 6 states, they have already made amendments in the COTPA. And so they are permanently banned, as in Punjab. But even if it is not banned, as I told you, there's a list of acts which can be invoked. So these are illegal entities, definitely.
Uh, Dr. Aruna has written here, flavored hookah appealing youth. What are your
Yes,
thoughts?
Dr. Aruna, I agree that the flavored hookahs, because they are appealing youth, because they are in there are 300 or more flavors are available now. and they are very attractive for the youngsters. But I may tell you that nobody will go to the hookah bars only for the flavors, unless there is some addictive material present. So most of the times it is the nicotine, but they can put any kind of addictive product in the hookah material. So, Dr. Aruna, I hope you'll be satisfied with my answer.
So, are there any emerging trends in hookah use among the youth generation, and what do these trends suggest you?
As I told you that now in bigger towns and the metros, so hookah bars, many hookah bars are present, right? And they are attracting kids by going to the social media, by advertising in the social media, though they are illegal entities, but they are definitely advertising in social media. And the emerging trends that e-hookahs are there now, like e-cigarettes, e-hookahs are present. Then, as I told you, that more than 300 flavors are available. So, and now the thing is that people who are providing hookahs, they go to, if you are organizing a party, they'll provide hookahs in a party also. Even in your house, they can provide. So I think these are the emerging trends in hookah smoking. It's no more a social
Right.
behavior.
It is
So,
becoming too easy to,
yeah, it
get
is very easy
into.
to get hookahs.
Yes. Dr. Aruna has seen thoughts, sir. Starts with flavor and gateway to nicotine and DHC dependence.
Yeah, THC dependence, this nicotine and THC dependence is there, definitely. Because I told you that though some of them may be supplying genuine those flavored tobacco products, but most of the times it is always mixed with nicotine or other addicting products. So it is not purely because I have rated at least 15 hookah bars when I was state nodal officer for NTCP. So I didn't find anywhere just flavored hookahs because the material that always contained nicotine because we
Okay.
got it tested in the labs also.
So as we were talking about new trends emerging,
Mm.
Dr. Surbi would like to know about what is herbal hookah.
Herbal hookah. They say that herbal hookah is organic thing. Only uh, I mean, what do you call that? In that Ayurvedic thing, no? It is like that, the herbal hookah. But I never found any herbal hookah. Definitely flavor hookah was there. They may be putting some natural ingredient into it, but definitely they were always mixed with the nicotine or any other addicting product. So there's nothing like herbal hookah, I'm sure.
Absolutely, sir.
They may be advertising as herbal hookah, but there is nothing like herbal hookah.
The side effects and everything will be the same as
Yes, yes. Because
ordinary
even
hookah.
if it is genuinely herbal hookah or the flavored hookah, still the carbon monoxide will be there.
Right.
Carbon monoxide poisoning can happen anytime actually.
So, how can communities actively engage in preventing and addressing hookah use among the youth, sir?
By organizing the webinars you have today organized, at least the doctors or the medical people will know what are the side effects of the hookahs. So they can disseminate the message, and maybe the communities also they get involved. And I think we must go to the press, go to the social media, and tell everybody about the side effects of the hookah smoking
I
and what
think more
when it
talking
is
about
not safer
certain
than.
topics will help, sir.
Can you say it again?
I think having more conversation over this topic
Yeah,
will actually help the community
correct.
and the youth.
We should go to the
Absolutely, sir.
schools, to the colleges, the public health people. They must go to the schools and colleges and tell the kids that it is not safe to go to hookah bars. Because most of the people they think that
Sir,
it's only
yes,
flavor,
sir.
so we need to tell them.
flavor, right? Absolutely. There's a myth about that hookah it doesn't contain nicotine.
Yeah, yeah, yeah. But I
So,
may
sir,
tell you
as
that.
we have already had, so we
Mhm.
had many sessions with you related to tobacco cessation.
Yeah.
So, what is the difference between, say, hookah cessation, tobacco, or non-tobacco cessation?
Practically, actually, there's no difference between the tobacco cessation and the hookah bar, or to that extent, even the e-cigarette use also. So the all the principles of the tobacco cessation, they remain the same. What I call you ABCD, that is active motivation. B, he is behavioral counseling. Then C is comorbidity management, and D are the drugs. So they remain the same. And healthcare professionals, they need to be proactive. They need to know that they must ask everybody about the tobacco or the hookah use, and they must advise the people to quit smoking. And if they can't do tobacco cessation themselves, they must refer to the specialist.